and welcome everyone. I know we're starting to come in here, but we'll go ahead and kick it off for this evening. Thank you so much for joining us for another Wellness Webinar Series event with Jefferson Health. My name is Sarah Breckville, and I will be serving as your program facilitator and will present your questions to our experts. Tonight, our experts will discuss comprehensive weight management options. Now, obesity is a difficult disease to treat as causes are complex and poorly understood. The amazing place we are in medicine today is that we can treat obesity as a disease using multiple treatment methods. And with those methods, there are varying risks and benefits. The greater the benefit, unfortunately, there are more risks, but all those risks are much lower than the complications of living with obesity. Now we can use medicines, surgery, or both to treat people based on a personalized treatment plan. Well, thank you so much to everyone for submitting your questions in advance of tonight. And the questions that you'll hear me asking the providers are all submitted right from when you registered for this webinar. Now, if you have any questions throughout our discussion tonight, for those joining us on your computer or tablet, at the bottom of your screen, you should see an icon that says Q&A. We'll do our very best to get to as many questions as possible, but may not be able to answer all of them during this virtual event. And due to hospital guidelines and privacy, we are unable to comment on specific cases. Well, with that, I want to go ahead and introduce our experts for the evening, starting with Dr. Mark Neff with bariatric surgery and Dr. Nathan Lent with obesity medicine. Thank you both so much for joining us. And first, I want to give each of you a minute or two to just say hello, provide a little background information about yourself, and then we can dive into the questions. So Dr. Neff, let's go ahead and start with you.
Well, good evening, everyone. My name's Mark Neff. I'm a 54-year-old surgeon at Jefferson Health in New Jersey. I'm a born and bred Philadelphian, a diehard Eagles fan, and a Phillies fan. And I've been practicing surgery for weight loss in the South Jersey area since 2007.
Amazing. Thank you so much for joining us, and we love the Phillies gear. All right. And Dr. Len.
Hi, everyone. My name's Nate Lent. I am, my official title is the Assistant Medical Director of the Jefferson Comprehensive Weight Management Program. So I'm one of the weight management docs, the non-surgical weight management docs at Jefferson. And a little bit about me. I am a former Army medic. I'm a former primary care provider, now full-time weight management doc. I work out of the Bala Cynwyd location with Jefferson, and I am really happy to be here with you.
Yes, and we're happy to have you. Okay, well, let's go ahead and dive into the questions because I know we received a ton. I'm excited for a really engaging, interesting discussion tonight. So let's get started. Okay, first question, Dr. Neff, this one is for you. Who is a candidate for weight loss surgery?
I think the candidate for weight loss surgery has to meet some insurance qualifications. And then there are some loose qualifications that Dr. Lent and I would have as medical providers. For insurance qualifications, you have to have a body mass index of 40 or above. And that's a calculation based on your height and weight. A body mass index of 35 to 40 with a medical condition that is severe and related to obesity, like severe heart disease, severe sleep apnea, or if certain insurances have actually lowered their criteria to as low as 30 with some medical condition like diabetes. But I think that Dr. Lent and I see a lot of patients with obesity, and I think that one of the things we recognize is the candidate for a surgical procedure really needs to understand the seriousness of the surgical procedure. It's just a tool, it's not a magic wand, and a person really has to be committed to using it properly to get a good result from their weight loss journey.
Okay. All right, thank you. Okay, Dr. Lent, we will turn to you. Along those same lines, who are candidates for weight loss medications, and are there age limits?
Okay, another good question. we think that probably about 50% of America, believe it or not, would meet criteria for a weight loss medicine. That doesn't necessarily mean 50% of America should be on a weight loss medicine, but just to give you an idea, we have pretty broad criteria for use of our weight loss medicines. Generally, if someone has a body mass index of 27 or above with a potentially life-threatening complication of overweight or obesity, or if they have a body mass index of 30 or above, even without a potential complication, that person would be considered a candidate for a weight loss medicine. And forgive me, the second part of your question again.
Age limits.
Thanks. Oh, okay. So actually, a lot of the weight loss medicines are approved for use in children. We, in our program, do not see children, but most of the weight loss medicines are approved, depending on the medicine, either age 10 and above or age 12 and above. So now there is no upper limit. So, we routinely treat patients in their 70s, 80s. I don't know if we have anybody in their 90s, but 70s and 80s for sure. And so it depends on the specific patient and the situation, but there is no kind of upper limit.
Okay. Okay. And Dr. Len, next question for you here. Let's dive a little bit into the medicines. So do we know the long-term side effects of medicine like Ozempic, Wegovy? And can you just go into a little bit exactly how do these medications work?
Absolutely. Yeah. So there are many things we still don't know about these medications, although they have been around for a while. The first GLP-1, it was released for diabetes, but it was released in 2004. So we have had these on the market for quite some time, but there's still a lot we don't know. As far as long-term side effects, we're pretty confident that muscle loss is a fairly common potential side effect of the use of weight loss medications. We do also know that if someone uses the weight loss medicines in kind of a supervised fashion and they, do their best to eat well and stay physically active, that muscle loss probably will not be a problematic muscle loss, and they may not lose muscle at all. So it is a side effect that seems like we can avoid it if we try. And of course, as part of our program, and really anybody prescribing these medications should be paying attention to that. So that's kind of a known long-term side effect. There are probably other potential side effects that we haven't really established yet. There are some reports that some people might experience mood changes like depression. In people with type 2 diabetes who use these medications, there is some concern that there could be ocular complications, so eye problems with it. And there's some thought that really, even in people without diabetes, different ocular complications can happen. To be honest, though, none of that is really proven yet. There's conflicting results. So it's just the muscle thing that we really worry about these days. So if you are getting your weight loss medicines and not having good, close medical supervision, consider reaching out to somebody, either us or your primary care provider, and we can help you avoid those potential complications. Keep in mind, the medicines are good, but they're not perfect. And generally in medicine, if anything works, it can have side effects. Okay. Now, great question. How do these things work? So GLP-1 is a hormone that our bodies make. GLP, the naturally occurring hormone, only lasts in our body for about 3 minutes. These medicines, they last anywhere from a full day to about a week. The most popular ones like Ozempic and Wegovy and Zepbound, you hear about Mounjaro, these last for a week. So the way they work is they take a mechanism that already exists in the body and really amplify it. When that happens, it decreases appetite. Basically, there are receptors for that hormone in the brain, in the appetite center. So they decrease appetite that way. They slow how quickly. They delay how quickly food flows through the stomach. So when someone eats, they get full faster. And they really sensitize and enhance the body's insulin responses and decrease how much blood sugar the body makes. So those are the main, they do other things, but those are the main effects in the body.
Okay. All right. Thank you. An important reminder to always talk to a provider. I think that was a nice reminder there. So thank you. All right. Next question. Still talking here about medications. Can you talk to us a little bit about the pros and cons of the different weight loss medications that are on the market currently?
Absolutely. Yeah. So generally, the pros are they work and their side effect profile is pretty favorable, meaning they're well tolerated. They can have side effects, they're not perfect, but most people do not have significant side effects. Those are the pros. The cons, we discussed, there may be some side effects out there we don't know about yet. That's one thing. The muscle loss issue is a potential con, and uh, the cost. The cost of these things are so high. So our whole healthcare system is really straining under the burden of the cost of these medications. So that's a pretty big con. Now, for an individual patient who has coverage, that doesn't matter. But for our healthcare system, it's an issue.
Okay. All right. And one last question here before we turn to Dr. Neff. Um, just talking a little bit about when you're on medication and your weight stalls, what should one do at that point?
It's a great question. This happens a lot. My answer may be a little dissatisfying, sorry, because it really depends. Really depends on the situation. I will say if someone's on a weight loss medicine and their weight loss stalls, it could be they might need to optimize their sleep. They may be stressed. They may have started a medication that can cause weight gain. They may not be taking their weight loss medicine properly, and that can cause it to not work so well. Um, we may need to increase the dose of their weight loss medicine if they're on one. Sometimes we need to add a second weight loss medicine or switch to a new one. So there's a lot of options. And the good news is if someone plateaus, and everybody plateaus eventually, right? The goal is to plateau at the goal weight. So if the weight loss stalls and you're at your goal weight, great, we're done. We're happy with that. The problem is if it stalls above your goal weight, then we have to get creative. And the answer really depends on the person and the situation.
Okay. All right. Thank you. Another reason to talk to a provider. So, all right. Dr. Neff, we will turn to you now. Can you talk to us about the advantages and disadvantages for weight loss surgery versus medications?
Weight loss surgery versus medications is one of my favorite topics in the office because I think that we're actually moving into a new era where it's weight loss medications plus surgery, or surgery plus weight loss medications, or weight loss medicine plus surgery plus medication. I think that we're starting to understand that these medications, these surgeries, they're all different tools in the same toolbox to help people who are struggling in the battle with obesity. We'll talk as this webinar goes through about the pros and cons of each. I think that surgery is a risky procedure. Absolutely. It does have more risks than taking a medication. But with more risk comes more benefits in terms of a larger percent of weight loss. But I don't think that there's ever been a magic wand we've come up with. I don't think there's ever been a magic bullet or a magic pill. I don't think medicine is that smart because we can't do one intervention at one single moment in one person's lifetime and expect it to work for the rest of that person's lifetime. So I really see that these work in conjunction together.
Okay. All right. And I know you mentioned pros and cons. Can you unpack that a little bit more? I'm sure there's a lot, but if you could give us a little bit of a high level overview.
Sure, I love to unpack. So, In terms of the pros of surgery, surgery offers a rapid weight loss. Surgery offers a larger amount of total weight loss for many patients. I mean, there are always exceptions. The pros for rapid weight loss could be very nice. Somebody who's trying to get a hip replacement or a knee replacement and has been told by their orthopedic surgeon they can't get that done until they lose 50 pounds, 75 pounds, 100 pounds, whatever it may be. And they're stuck because they need the weight off fast. Same thing for a person who maybe is trying to qualify for a transplant procedure or trying to battle congestive heart failure. We've seen surgery be, really advantageous in these populations. Um, I think the cons are it's surgery. It's painful. There's a 3-month process for most insurances to qualify for the surgical procedure. There are risks of the surgery, even though the surgery in today's world, it's safer than heart operations, it's safer than hip operations, and as you described, safer to get the weight off by either medicine or surgery than to keep carrying the weight around. But it does still have risk. There is a 1 in 900 death rate that comes with these surgical procedures. And while all our data is submitted to national data banks, hospitals that do these surgeries are surveyed every 3 years. Our survey here at Jefferson in New Jersey is coming up on January 15th. Anybody who sees me around that period of time will see an extra bead of sweat on my forehead. But the surgeries are about as standardized as we know how to offer them in today's world.
All right. Thank you. Okay. Dr. Lent, we'll turn back to you now, talking a little bit more here about medical intervention. Is there a certain weight or BMI in order to be considered?
For weight loss medications, yes. Yep. There is no weight cutoff, but there is a BMI, body mass index cutoff. Um, Tangent for a second, body mass index in a lot of ways is not a great indicator of health, but we have to acknowledge it is the thing we rely on. So if someone has a body mass index of 20, between 27 and 30, and they have a potentially life-threatening complication of overweight, and I'll give you some examples: high cholesterol, high blood pressure, breast cancer, cervical cancer, uh, if they have a history of there's so many things, history of certain eye problems, fatty liver, all of these things. It's you don't have to be in imminent danger to qualify in the overweight category. So that's the most complex criterion, but the easiest criterion is anybody with a body mass index of 30 or above. So it's a lot of people. Doesn't mean it's a right for everybody. And for some people, actually, like Dr. Neff said, for some people, bariatric surgery probably is a better treatment than weight loss medicines. But
Okay. Yeah. And Dr. Neff, what would be the BMI for surgical intervention?
So for surgery, for most insurances right now, you need this body mass index of 40 or above, which basically represents a patient who's 100 pounds over their ideal body weight. A body mass index of 35 to 39.9 with a serious medical comorbidity related to being obese will qualify you for most insurances. And then there are select insurances have lowered the criteria down to 30. But I think that that initial insurance approval, it gets complicated because sometimes if your insurance is through a employer, they may not have selected benefits for weight loss surgery. So for the person who's interested, I suggest make that appointment with the surgeon or Dr. Len, and we can help you with understanding what is this whole insurance quagmire of will my medication be covered? Will my surgery be covered? Do I qualify? What would the cost be? I think that if you're considering it, it's worth taking a dip into the ocean and starting to explore what are the options out there.
Absolutely. Okay, thank you. All right. Dr. Neff, a follow-up question for you here. No, you mentioned that, maybe there could be a potential to lose even more weight with surgical intervention. So can you just talk to us a little bit about that, about what one could expect with surgery versus medication for weight loss?
I apologize. So you mean the actual amount that a person could lose?
Exactly. Yep.
Sure. So I'll tell you this, I try not to promise my patients a certain amount of weight. But I do answer the question, when they ask this to me in the office. And I usually offer them some qualifiers that it depends on your height, your weight, your age, your sex, your race, where you started from, your attention to a diet, and your attention to an exercise plan. All that being said, the average weight loss for a surgical procedure we call a sleeve is about 50 to 70% of your excess weight. For a surgical procedure called a bypass, typically 60 to 70% of your excess body weight. And for surgical procedures that we call SOTIs or duodenal switches, it's typically 70 to 80% of your excess body weight.
All right. Thank you. Okay. Dr. Nev, what are the risks of surgery compared to medications? And what are the benefits? I know we kind of talked about this earlier, so if there's anything else you'd like to add here, feel free. Otherwise, we can move to the next question.
Oh, I'll get into the gory details since you asked.
Okay.
So, in my final meeting with patients prior to the surgical procedure, or when my nursing practitioner meets with them, we discuss the really gory details of, what are the risks of going to the operating room. The risk of dehydration after the surgical procedure is about a 10% chance. The risk of infection is about a 5% chance. The risk of bleeding after the procedure, about a 5% chance. The risk of something that we call a leak in today's world is about a 1% chance. Actually, in our hands here at Jefferson, it's even been half of that. The risk of a blood clot is a 1 in 250 chance. And again, I think I said earlier, but the risk of death is a 1 in 900 chance. All of these safer than heart operations, safer than hip operations, and safer to get it done than not to get it done. That's actually been very well studied. If you split the universe in half and a person had the surgery and a person didn't, 10 years later, it's more dangerous to keep carrying around the weight than it would have been to undergo the surgery, even with all the risks and gory details I just discussed.
Wow. Yeah, that's an interesting way to look at it. So thank you. Okay. All right, Dr. Lent, we'll go to you now. Um, Question for you about medications. Do patients take medication forever to maintain weight loss? And what happens when a patient decides to end the medication?
Another great question. So we do not think people need to take these medicines forever. We previously thought that, but there was a study that came out a few years ago that showed that was probably not the case. So we do not know exactly when is the best time to stop the medications, but we do not think it needs to be forever.
Okay.
So
All right. Promising news. Okay. Next question here. For someone starting this medication for the first time, what is the recommended time frame to see results?
in the studies where these medications were first evaluated and the ones that really seem to provide the best data, 6 to 12 months. We do see some people who lose significant weight before that, but often if they do, they're, it's not for good reason. So too much weight loss too quickly is not a good thing. So really, we like to see it, when if at all possible, like six to 12 months. But generally 12 months. So it's not a real, rapid weight loss, and that's probably a good thing.
Okay. All right. Thank you. Okay, Dr. Neff, going back to you here. I know you mentioned insurance coverage earlier and the importance of maybe starting that conversation. So this question here, does insurance cover weight loss surgery? No, it's a broad question, but anything you'd like to add?
Yeah, most insurances will cover weight loss surgery. I do think you have to check your insurance plan, and we have two navigators in our office to help patients answer that question. Um, I think that also getting the surgical procedure requires that commitment to the pre and post-operative care. When I talk to patients in my office, I often use the analogy of shopping for a car. And you have to choose the car. People choose different cars for different reasons, but you have to be prepared to read the owner's manual. You have to be prepared to do the proper maintenance. It's more than just can you qualify for the loan for the car. It's, are you prepared with what comes with it? These surgical procedures, they can potentially be dangerous long term. A person can end up with a vitamin deficiency long term. They can end up with iron deficiency anemia long term. They can end up with terrible reflux long term. Sometimes in women of childbearing age, I have to face the interesting side effect of these operations, which is they get pregnant because fertility improves as you lose weight. So I think just like Dr. Lant was describing the medicines there, you really need to be prepared to work with a medical provider when you get a medication to identify the side effects. And you have to be prepared to follow up with your surgeon if you're going to get one of these surgical procedures. If not, even if your insurance does cover it, it may not be for you.
All right. And Dr. Lent, one more question here before we move to the live questions, which I know a lot of you have been typing in your questions, so thank you. But our last submitted question here, Dr. Lent, are there medication options other than injections?
Yes, there are. And, even just a few years ago, these GLP-1s really were not, they weren't out, so prior to that, we did have other weight loss medicines. So there are some pills. There are generally three to five, depending on who you ask, 3 to 5 good weight loss medications that are not injections, that are pills. So um, that kind of could be a whole talk in and of itself, but just know it's important to know. So if someone really hates needles, you still have options. If someone does not have insurance coverage for GLP-1, you still have options. If you take GLP-1 and it does not agree with you, you still have options. And by the way, one of those options is potentially bariatric surgery. So yes, you have other options. So don't give up. If you don't have a GLP-1 coverage, all they do is help you eat healthier, right? We can help you eat healthier in other ways.
All right, thank you. All right, well, with that, I want to go ahead and turn to our live questions now. I know that you both have been responding to some in the chat, so thank you. Appreciate the multitasking happening. So, before I dive into our remaining questions, wanted to open it up if there's any questions in particular that you saw come through that you'd like to comment on before I go ahead and just run through some of the questions here.
Uh, Thank you. I actually have one, and I want to apologize to Sir Sin Pemberton. I pressed the wrong button. I wanted to answer that question, and I think it's a very interesting one. The question was about not being able to turn off the eating all the time message my brain is receiving. And there's a very interesting comment about this. I listened to at a recent conference I went to in June. Dr. Lent might want to expand upon it, but it's this idea of food cue reactivity. It's this very specific term that's now being used to what these medications do and how they turn down the food noise in person's head. And I think that's the area that we're getting into now, which is understanding that, surgery doesn't do everything for patients. And, utilizing a medication in the post-operative care of a bariatric surgery patient is almost like offering adjuvant chemotherapy to a cancer patient. It does something a little bit different than what the surgeries do. So for that person, I apologize. I pressed the wrong button, but I think that type of messaging coming from your brain would be very nicely addressed by a medication.
And Dr. Lent, anything you'd like to add to that?
No, Dr. Neff nailed it. Yep.
Perfect.
Medications are not perfect. They do tend to help with that sort of thing. Yes. And so, our bodies love to gain weight. Our bodies don't love to lose weight. Our brains will often fight it. And that type of food noise can be very troubling, very bothersome, and result in weight regain. So we often do rely on medications to help with that symptom.
Okay. All right. Thank you. Okay. Let's dive into a few more questions that have come through. And thank you all for submitting such great questions. The next one here, Dr. Neff, can you talk a little bit about the type of surgeries that are available for weight loss? And what is the recovery plan look like?
Types of surgeries and recovery plan. Okay, so I think that these surgeries come in different flavors. In some ways, it's almost like a small, medium, and large. These surgeries, they've been around in different forms since 1965. They've been done through small incisions since 1994. And over the years, some surgeries have come and gone. But right now, we have a surgical procedure called a sleeve, which is very popular, where we say that there's something wrong with your stomach and we need to remove the portion of your stomach that's not working properly. I like to think of that operation as the quote unquote small. It has the shortest stay in the hospital, shortest time in the operating room, quickest return to activities, and about 50 to 70% excess weight loss. In my car analogy, I think of that as like a hybrid car. In the gastric bypass is sort of like the medium. It says something wrong with the stomach, but we just need to reroute the flow of food. It's an operation that stood the test of time. It has a medium operative time and a medium stay in the hospital. It's an operation that I like to think of as the quote unquote Cadillac because it's been around the longest. The operation called the duodenal switch with a newer version that's being practiced at many centers and here at Jefferson called the SADI. It says there's something wrong with the stomach and something wrong with the way the intestines are working. And what we're actually going to do is bypass a large percent of the intestines. It's the most malabsorptive procedure on the marketplace right now. Longest in the operating room, most risks after the surgery. It's the quote unquote small, medium, and large. It's the large. And I consider that operation the quote unquote Lamborghini. It's the most complicated of the cars that we surgeons offer.
Okay. Perfect. Thank you. All right. We'll go to the next question here. What are options for weight loss for those who previously had weight loss surgery and are struggling because the weight came back?
So I'll jump on that, but I'll invite my esteemed colleague to comment on that afterwards. Certainly a revision is an option. We can revise all of these surgical procedures, but I am much more in favor of trying a medicine first, revisiting a diet and an exercise plan. As Dr. Len said, the body doesn't like to lose weight. And as a person gets older, medications may change, activity may change in women, hormonal changes as they get older. So I think that speaks to the idea that you need to keep working with your medical providers, your bariatrician or your bariatric surgeon, your dietitian to make sure that you're keeping the weight off. And when the weight is coming back, it's time for another tool in our toolbox.
Absolutely. And Dr. Len, anything you'd like to add there?
Nope, totally agree. Dr. Neff nailed it again. Yeah, we have a pretty broad armamentarium that includes medicines and surgery. So, um, and we all focus, and it's natural to focus on medicines and surgery. I haven't done a good enough job, I think, of also pointing out lifestyle modifications. In addition to bariatric surgery, in addition to medications. Especially if someone's regaining weight, we really should make sure we do our best to optimize sleep, optimize your stress or minimize and manage stress. Both of those things, poor sleep and high stress levels can promote weight gain. Um, Lack of physical activity has been shown to be a major contributor to weight regain, whether someone's lost weight with surgery or with medicines or with neither. So optimizing those lifestyle things is really crucial as well throughout the whole weight loss process, whether you have surgery or not.
Okay. Actually, as a follow-up to that, Dr. Len, I think this next question is a nice segue. This question here is, what are some of the health benefits that your patients are seeing after losing weight with medicine or surgery?
Weight loss, weight loss helps with almost everything, really. By that meaning it reduces the risk of most of the things you want to reduce. So with even just 10% total body weight loss, and for surgery, 10% is like that's easy. That's an easy day. For medicines, 10% is, takes a little bit of work. But a 10% total body weight loss has been shown to reduce the risk of heart attacks and strokes and diabetes and high cholesterol and breast cancer and other cancers. So it's it's worth pursuing.
Okay, thank you. Okay, next question here, and I'll ask you again, Dr. Lent. We talked about this a little bit earlier, but if we could go into a little more detail here, this person wants to know, how does one maintain weight loss after GLP-1 use? Do you continue using it at a lower dosage, or then would you just go off completely?
Good question. I would encourage everyone think about a weight loss medicine kind of like think of like a blood pressure medicine, right? If someone comes in, their blood pressure is high, we try to get it down with lifestyle modifications, right? Sometimes it works, a lot of times it doesn't, right? So we use a medication. Hopefully their blood pressure goes down. Hopefully they don't have side effects. What do we not do? Stop the medication, right? Because if we stop the medication, the blood pressure is going back up. We kind of think of the weight loss medicines in the same way. So generally, if we do something that allows for weight loss, and that applies to diet, exercise, medications, if we stop doing that thing, the weight will come back. So it is true that we don't think we have to use the medications forever, but generally we do recommend people continue to take the medication for at least several years. So,
Perfect.
so that's what helps keep the weight off. But eventually, yes, probably will stop the weight loss medicine. It's the stress, the sleep, the healthy eating is really crucial. Physical activity can be very helpful.
Okay, perfect. Thank you. All right, next question here, and this could be for either of you. This person wants to know, how rapid of a weight loss is too rapid? We talked a little bit about plateauing, but on the other side.
Yeah, I'll jump in and kind of for the medical non-surgical weight loss, we generally think, maybe a pound a week. So first off, there's no perfect answer to this question because it kind of depends on the person. You know, some people are really tall and they should be heavier, and some people are not so tall, like myself. You can't tell, but I'm a shorty. But so those, so a pound a week for me might be very different than a pound a week for Shaq. So it depends a little bit about the situation, but about a pound per week, maybe 2 pounds a week, depending on who you ask. Anything more than that is kind of a red flag. It can be a healthy weight loss, but it's high enough where we start to, give it the side eye and have to ask a bunch more questions. So that's how it is, at least that's in the non-surgical setting. But I think we should let Dr. Neff kind of weigh in when it comes to surgery.
I feel like I've been pitched a really complicated spitball. So I'll tell you, when I started my career, I was very nervous about any patient that lost more than 3 or 4 pounds a week with an average weight loss between, 15 and 20 pounds a month. But now at this point in my career, I think Dr. Len said it, not everybody is equal. And some people, they lose it faster, and some people lose it slower, and some people hit these weird plateaus. When a patient is losing it very fast, I do get more concerned about proper nutrition, proper vitamin intake, proper protein intake, proper hydration. I check their labs more regularly. But I have seen patients who lose that 100 pounds, 150 pounds, in the first 6 to 9 months and don't suffer any consequences. But I do give them the side eye when they're losing it very quickly to make sure they are getting proper nutrition in.
Okay. All right. Thank you. All right. Next question here. I know we talked a little bit earlier about BMI and maybe it not always being the most accurate representation. So I think this question kind of relates to that. This person says, where do I find what my ideal body weight should be for someone with my age and height?
Ooh, I'll take that's a tough one too. Um, you know, there kind of is no ideal body weight in a way, you know. The ideal body weight, we think, is when someone's blood pressure is good, when their cholesterol is good, when their blood sugar is good, when they feel good, you know, if they had knee pain, when the knee pain's better, things like that. So we don't really focus on the weight. The number on that scale is not really what we're looking at. It's these other health parameters. We have BMI charts out there. I would encourage people to try to ignore them. We do kind of use them. We kind of have to use them, but they're kind of trash. They're young, healthy white people. Those BMI charts are generally based on not a diverse group. BMI does not account for muscle mass. So, if you, I know Dr. Neff's a Eagles fan. Think of like Brandon Graham, right? That dude is all muscle, right? If you look at his BMI, it's probably pretty high because for his height, he's heavy, right? And he might have no body fat. So it isn't really the BMI isn't really the weight. It's more the body composition. And so I would highly encourage people, don't focus on what the scale says. Try to ignore the BMI charts. Really focus on those other health parameters.
Okay. All right. Perfect. Okay. Next question here. How effective are the weight loss pills versus the injections?
I like Dr. Neff's car analogy. What I say is like the GLP ones, it's like a BMW or a Ferrari, and the pills, it's a little bit like a Ford Fiesta. Uh, Not exactly. I'm exaggerating a little bit. I'm trying to be funny. In reality, the pills for some people are very good, and for some people they are the right answer. But if you're comparing them kind of directly, they're about half as effective as Wegovy, which is the least effective GLP-1. They're about a third as effective as Zepbound, which is the most effective GLP-1 if you consider, about a year's time. So.
All right. Thank you. Okay. Next question here. And whoever wants to jump in, feel free. Can you talk about who is part of the care team at your comprehensive weight management program? And do your wellness teams provide nutrition counseling?
Well, I'll jump first. But I'd like to say similar to the message I think we've been delivering, this is a spectrum of care where everybody sort of works together. In my office, we have two navigators, a nursing practitioner, a nurse, practice manager, insurance specialist, and three surgeons, and we're just about to add a LCSW to do counseling. So we're pretty good. My goal long term is that we have a one-stop shop where Dr. Lent and I, or the surgeons and medical providers are also in the same spot. I also think that we need an exercise physiologist, which we haven't gotten to yet. And I'd love to see that one-stop shop also include the pulmonologist, cardiologist, gastroenterologist, because so much of what happens to a patient after surgery affects all their other disease processes. So, what I think we have a pretty good team at Jefferson right now, but I think we're only halfway evolved to where we should be.
Okay. All right. Well, thank you. Well, that about wraps it up. I do want to open the floor if there's any other questions that came through that you would like to address, either of you. Feel free. Otherwise, we can turn to a final question for the evening, which is my final question. So, yes, Dr. Neff or Dr. Lent, feel free to let me know if there's any questions that you would like to address before we kind of wrap things up.
Yeah, I do have one.
Yeah.
We haven't talked much about kind of young women, the potential for pregnancy and, postpartum period and breastfeeding. So it's important that everybody who's thinking about weight loss medication, none of the weight loss medicines are considered safe in pregnancy. So if someone's trying to conceive, we generally recommend they do not take a weight loss medicine. With that said, one of the best parts of this job is when I see somebody and they want to get pregnant, next year or the year after, and we work together to make them healthier so they can have a healthier pregnancy. So we are not anti-pregnancy. We are anti-oopsie. So keep that in mind for anyone who can become pregnant, young women, and anyone who can become pregnant, make sure you talk about that with your provider. And please try not to get pregnant while you're taking these medications because they may, we don't know for sure, but they may cause birth defects. They are also not recommended during breastfeeding. But we do not want people to stop breastfeeding just so they can start their GLP-1. We want you to continue your breastfeeding as long as you would otherwise, and we can help with weight through other ways, just not medications.
Okay, thank you. An important call out. Appreciate you bringing that up. And Dr. Neff, any final questions that you'd want to call out based on the chat before we wrap things up?
Sure, it's not specifically on the chat, but it's something that's been percolating in my mind during all of this. Um, and I tried to touch on it before when I said about the magic pill or the magic wand or the perfect surgery. Um, Obesity is a disease process that people struggle with their entire lives, and how they approach it in their 20s may be different than how they approach it in their 30s when they have little kids and a spouse, and it may be different when they approach it in their 40s and their parents are now getting ill, and in their 50s when their kids are off in college and they're going through menopause. I think that we have a lot of understanding about obesity. We're still learning more each and every year. Um, but that's why there are so many diets out there, and there's so many misconceptions and TikTok videos and social media, because people are trying to figure this out themselves. And it's like a scatter plot. There's so many different factors that are important in caring for the obese patient. So, I think people struggle and they get frustrated because they're trying to figure this out themselves, and they shouldn't be trying. They should be coming to the medical provider, because truth is we struggle a little bit, and we have 28 years of schooling underneath of us, and but we can help you figure it out and work with you to get this disease process under control.
Absolutely. Yeah, I think that's a really great point. You're not going to find the magic answer by scrolling on TikTok. That's for sure. Um, I guess actually one question here. Do you mind just kind of talking about the process of getting, weight loss medication, or maybe even if you want to talk about how you start the process of surgery? Would a person visit their primary care physician first? Should they set up an appointment with you all? How does that work?
Well, I would offer, I think you come to visit somebody like Dr. Lent or somebody like myself. It's almost like no matter where you enter into the Jefferson enterprise, we can steer you to the right place that you need to be. But I don't think that the conversation begins and ends with your primary care provider. They're very good, but this is a specialty all in of itself right now. And just like you don't go to see your primary care provider when you're trying to figure out treatment for my cancer, you shouldn't really be coming to your primary care provider to come to the ultimate decision on the care for your obesity.
Okay. Yeah, I think that's an important call out and good for people to know. Okay. Well, with that, I want to go ahead and ask my final question for this evening, and that is, what are your goals for everyone listening in on this webinar? What would you like people to take away from tonight? Dr. Neff, we'll go ahead and start with you.
Oh, goodness. My take-home messages. I was trying to write this down in between um, questions and typing answers. And actually, in the background, I also spilled my drink, and my wife's going to be really mad at me.
A lot
I
going
think,
on.
yeah. So my take-home messages would be the following. Medicine, surgery, combination therapy, these are tools in the toolbox for the obese patient. um, that we have a lot of expertise at Jefferson. We have a lot of providers who specialize in this. And we've had a lot of years of experience in treating obesity. Obesity is a lifelong disease, and no one therapy is going to work for an entire lifetime. And then the last thing I would offer, and it didn't actually come up in any of the questions, but there's a tremendous amount of attention now to weight stigma and weight bias. And, so coming into our offices, you'll never find a safer place to come to talk about being overweight and your struggles and where we go from here.
Okay, thank you. I think that's a really important call out. Okay, and Dr. Lin, any final takeaways?
Yes, thank you. To kind of piggyback on what Dr. Neff said, a lot of times there's bias because there's been this thought that if any of us are overweight or meet criteria for obesity, that it's a character flaw or a weakness. That's just not true. This is a disease. And just like if someone has rheumatoid arthritis, we don't judge them for having joint pain, right? They didn't ask for rheumatoid arthritis. They didn't, it's not their fault. Same thing with this. I mean, do we have the ability to make good decisions and bad decisions with food and stuff? Yes, except we have an animal brain that's really driving those decisions. And a lot of people live with the, flawed assumption that we have control over our own weight. We really don't. So this is a disease. If you are suffering with this disease, it's not your fault. There is help, and we can help you. Not all primaries are up to speed. If your primary is up to speed, great. If not, come see one of us and we can help you. So this is doable. I want everybody to remember the medicines are great, but surgery is the right answer for a lot of people. And whether you do surgery or not, lifestyle modifications, sleep, stress, physical activity, diet, all that stuff is really important. And we can help you. It doesn't happen quickly. It takes some time, but it is worth the effort.
All right. I think that was a perfect wrap up. So thank you both so much. Really appreciate both Dr. Neff, Dr. Lent, for you and for sharing your time this evening. Such great information was shared. And thank you all for attending, for submitting such great questions. I know I learned a lot, and I hope you did as well. We will be posting an event survey, so you can let us know your thoughts. Any other specialties you would like to hear from? If you would like someone to contact you directly to schedule an appointment with a Jefferson Health provider, please go ahead and fill out the last question in the event survey. You can also visit jeffersonhealth.org to make an appointment, stay up to date on upcoming events and webinars just like this one and more. Please also visit jeffersonhealth.org/livingwell for more health content, patient stories, research, and innovation. You can also visit the Jefferson Health YouTube page to view more wellness webinar series events. We have various topics from back pain to robotic surgery to previous weight management webinars. A recording of this event will also be sent to you so you can rewatch at your convenience. If there is anything anyone here at Jefferson can do for you, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Have a wonderful evening. Good night.